Welcome back. Now, civil liberties are often seen as a necessary sacrifice in the fight against a pandemic. The COVID-19 response in Kenya comes into focus tonight. Can we have our cake and eat it too when it comes to preserving our personal freedoms and human rights in the middle of a pandemic? Well, joining me now to unpack this is Dr. Githinji Gitahi, Global CEO, Amref Health Africa, and Irungu Houghton, Amnesty International Kenya Executive Director. Gentlemen, thank you so much for joining me this evening. I want to get your initial reactions to the President's address today. I'll begin with you, Dr. Gitahi.
Thank you, Victoria. I spoke on Citizen a few days ago. This was expected. I said, and I will still say the same, that the issue is not about whether to open or not. The issue is whether we are prepared for rising infections and possible rising severity of disease and therefore expected death. In fact, I was asking some people, who are putting pressure on opening, and I said, are you individually willing to sacrifice your relative who is above 60, who is vulnerable? If you're not willing to sacrifice your mother or your father or your auntie or your grandmother or your grandfather, then you should not be pushing for us to open when we are not sure about preparedness. So the President's address, in my view, is measured, is cautious, and it is the right thing to do. The extension of curfew hours to 9 p.m., of course, gives people a bit more leeway. I think the burden that the President has pushed back to the Minister of Health and the counties is, get your act together. Because we cannot continue with the measures forever, and no measure will stop the virus. The measures are just to give us time to prepare so that we are ready for an increased rate of infections. But even that doesn't mean that even after 30 days that everything will be opened up.
Right, and of course, Kenyans are hoping that it's opposite result. Irungu, let me bring you in. What did you make of the President's address today?
It was wise. It was a seasoned policy statement, I think, that was grounded in development data. We got a sense of the trade-offs and the choices that our government has to make it at this time. And I think it was a good decision to make, notwithstanding that there may be several people from CI who will be pinched tonight. But I think in the absence of mass testing, in the absence of enough isolation centers and wards, and secondly with the infections increasing, we have really no choice but to continue the discipline that we are trying to create as a nation as we flatten this curve. And I think it's going to be difficult. I know the trade-off is really between public health and livelihoods. But I think this is a path that we have to continue to walk carefully. And just to come back to your initial comment, Victoria, actually, it is in a time of a pandemic that you need a human rights approach. Obviously, a pandemic is first and foremost an attack on our right to health and the right to life. And therefore, the Constitution and the fact that it is not suspended at this time is extremely important as a moral beacon for not just our government, but for human rights organizations and citizens, that we understand that at this time, our very right to life is threatened, not just by a pandemic, but by the secondary impact of a pandemic, which is the right to food, the right to shelter, and so on.
Right, and the WHO had been calling for this human rights approach throughout when it came to responding to this pandemic. And from what you've observed over the last 3 months that we've been dealing with COVID-19, and have we stuck to that or deviated a bit?
So I think there have been a number of important, significant steps in the right direction. The first, I think, was not to suspend the Constitution at this time. Many African countries did this, but we essentially proceeded to flatten the curve using public health guidelines, which meant that the Bill of Rights is still in place. It guides and regulates and should be regulating all government agencies, including the National Police Service at this time. I think the second step that was taken that I think was important was really to close our borders and to essentially begin the process, albeit that it took some time to get going, of quarantining and isolating people and also testing people. I think these are the steps in the right direction. We have also seen a number of missteps. We've seen mandatory quarantine centers that were recklessly managed, that they were not equipped, nor did they follow the ministry's own protocols. And I'm glad to see that there's been steps towards correcting that now. And first and foremost, really, I think, was the decision essentially to have these mandatory quarantine centers essentially funded by taxpayers and not expect 47 million people or whatever the number would be, to have to pay for what is an essential service at this time. I could go on, but I think that will be the first set of comments.
And Dr. Gitahi, throughout this global response to the pandemic, you've been seeing several quarters talking about civil liberties will be infringed upon when you're dealing with a pandemic. And you're kind of caught in between people making a sacrifice, letting go of certain civil liberties and personal freedoms for the greater good, which is, in this case, to fight a pandemic. But, can we strike a balance? Is it possible? So it's not a public health versus civil liberties kind of conversation.
Well, I would like to start by saying that public health is about population health. It's about the larger good. And the larger good, if you look at the principles of utilitarianism, you're saying that at all times, the happiness of the majority, or the safety of the majority, is supreme to the individual safety, which is why sometimes we say in public health, if somebody, and if you look at the Public Health Act, it is very clear that if anyone is going to endanger other people, then the Public Health Act can be invoked, in which case measures can be taken to ensure that the other people's health is safeguarded. And this debate has been going on for many years. This debate has gone on for vaccination, for example, where the choice as to whether to vaccinate your child or not is not purely a personal choice. It's a public health choice, because if you don't vaccinate your child against an infectious disease, then you pose a danger to infect others. The reason smallpox was eliminated was because vaccination against smallpox was actually made mandatory. And therefore, you developed a system where everyone was vaccinated, and therefore that curtailed the movement of the disease. So there are instances where you may have to look at the public good or the goodness of the majority over personal liberty. But then remember also that this is not a fiat to overlook personal rights. In fact, there are people who say that in a pandemic or in a situation like this, if you overlook personal rights, then you endanger public health, because then people might be forced to revolt or to disobey, in which case you endanger the public health measures you're trying to do. So the balance is critical, but the balance must always be in favor of the goodness or the majority.
And speaking of how one can respond to interventions, for instance, so we saw in Pretoria, the High Court there found some coronavirus lockdown regulations imposed by the government unconstitutional and invalid. And aside from some human rights violations that we saw in the past week, such as, the night demolitions, what can a citizen do in terms of challenging an intervention by government in court? We've seen that happen in South Africa. For someone who feels this is too punitive, what can they do, Irungu?
So I think there are a number of things that citizens can do. First of all, their rights have not been suspended in terms of the Bill of Rights, and Article, Chapter 43 of the Constitution remains in place. They have the right to assemble. They have the right to organize. They have the right to free expression. But of course, now with COVID, that right has to be measured back to a gathering of no more than 15 people. And I think what many of us have been arguing is that it is precisely at this time that involving the public in terms of safeguarding the rights of others is the surest way of ensuring that we flatten the curve. The more anxiety, the more fear there is, the more violence there is in the society, the less likely you are able to have a whole of society approach to this issue. And, for us in Amnesty, we have been very concerned, by, for example, the evictions in Kariobangi North and in Nakuru and other places. And one of the issues that we have raised, and I think it's up on both the Interior Ministry, but there was a meeting, a very important meeting that took place yesterday, where all the stakeholders in the security sector, in a meeting chaired by the Cabinet Secretary for Interior, had a very frank and at sometimes very intense conversation about the quality of policing that we've seen over the curfew. And, the statistics are fairly clear. The Director of Public Prosecutions is currently investigating at least 171 cases of police brutality, and at least 23 of those cases are cases of murder. So the issue of police brutality is not just anecdotal. It's not just this 13-year-old Yasin Moyo that was shot on his family balcony. It's not the story of Waiderero, or Waite as we call him, the homeless man that was killed in Madare at the beginning of this week. It's not just the story of Samuel Maina, who was beaten almost to a pulp, that he had to have his nose reconstructed. These are patterns and trends that have to be arrested immediately in order for us to do this. And I think the meeting came out with, three important decisions and recommendations. The first was that the Cabinet Secretary reaffirmed that there would be no forced evictions, no further forced evictions that would take place during the time of COVID-19. Secondly, that he would recommend to the National Security Council that the Independent Policing Oversight Authority and the Kenya National Commission and other human rights organizations would be listed as critical and essential services. This means that human rights organizations can get into communities, can reach out to homes and households where we are seeing a rising number of cases of violence between intimate partners or gender-based violence. And I think these were two important points. The third one really was that the Director of Public Prosecutions will begin to accelerate cases, and the Inspector General also in this context reaffirmed his personal intolerance for police officers. And he made it very clear, this was captured, I think, by Citizen Television and others, that any individual officer that commits a human rights violation to this period will carry that as a personal liability. It is not the policy of the police service. And I think as human rights organizations, we will continue to document these cases, investigate them, and bring them to court.
And Irungu, beyond a police officer carrying that as a personal liability, a big player in all of this in terms of prosecuting police officers and ensuring that they are locked up is IPOA. And many have argued that we have many complaints being lodged at that body, but not enough of them actually going to court and seeing cops, put in jail. How do we change that trend, if you will, and incapacitate IPOA?
Yeah, so I think the first thing is to look at the criminal justice system as an ecosystem, as a comprehensive set of players. And many cases don't get to court. They don't even get past the Director of Public Prosecutions and his team because evidence is misplaced, crime scenes are spoiled or are damaged or interfered with, and thirdly, that witnesses are intimidated. So it is really at the initial stage that we have to have a vigilance among the public that they report very quickly. They do not destroy evidence, even inadvertently, that they actually preserve evidence. And we have had cases where we have picked police cartridges, cartridges from bullets or tear gas canisters, and we've asked the public not to hand them back to the police, but to hand them over to the Independent Policing Oversight Authority. It is the Independent Policing Oversight Authority that I think has the primary responsibility of investigating these crimes and ensuring that with the agreement of the Inspector General and the the Internal Affairs Unit, that these cases are brought to the Director of Prosecutions with enough evidence for him to be able to prosecute these cases. And as I said, there are 171 cases against the officers at this point. I think yesterday we also made, the point collectively that there needs to be more unity of purpose across the institutions, that human rights organizations and law enforcement organizations need to work much closer together, and that even when we are disappointed and that we are dismayed by the spike in violence, we need to stay at the table so that we can continue to point out the cases and seek justice for every one of these victims. And I think this has been one of the consequences of really, what has been happening in Minneapolis and across the world with the murder, the very brutal murder of George Floyd a week ago,
right.
And how this has actually generated a sense of urgency that we must not allow, more Floyds on our soil. We have many Kenyan Floyds, and many of them need to receive justice for this. But we must also preempt this from happening. And we made a proposal to the Inspector General and also to the Minister of Interior that, allow human rights organizations to join the night patrols, allow us to do joint civic police patrols. And that way that we can ensure that the tension between communities and the tension with the police, that is reduced.
Dr. Gitai, let me finish with you. And in terms of response to, be it a tragedy or a crisis, sometimes you can see temporary measures put in place for that period that eventually spill over into a permanent change. For instance, after 9/11, we saw air travel change for good, with many protective measures being put in place. In this time, during this pandemic, we've seen several preventative measures put in place. Do you see some of them spilling over into the future and creating this quote-unquote new normal?
Yes, and many of them will actually spill into the future. For a very long time, even before COVID, we've advised people that hand washing is a necessary public health measure to reduce unnecessary or preventable death. For example, we know, for example, that hand washing significantly reduces death of young children, or what we call neonatal mortality. We know that hand washing reduces the rates of pneumonia. But for a very long time, we've not been able to entrench this message as a key behavior change. Now, with the sustained measures for COVID-19, we expect that hand washing, not only hand washing as a behavior itself, but also investments in hand washing. We are seeing now, as we go back to school, we may get investments in water and sanitation. As we resume work, people are investing in hand washing. So that, we hope and we believe, will stay as a significant behavior change for people. The other thing we might see is handshaking. That could be, a cultural thing of the past, that people, will forget that handshaking is a necessity and will adopt new ways of salutation. So we expect that. But of course, we are also going to see changes in travel. We are going to see that airlines, for example, are going to change the way people travel. People might be required to wear masks for a long time. People might be required not to sit next to each other for a long time, in which case capacity of aircraft will reduce. We've seen some of the aircraft say they're going to reduce their capacity to 60% to allow social distancing. Certain industries like conferencing and meetings are going to be affected for a very, very long time. So we see these things that are going to stay. But I think, to get back to what Irungu was saying, it is also a chance for us to actually see the centrality of public health in everything that we do, because the response to COVID is not like the response to hypertension or diabetes, which has been seen more like a vertical issue. We are starting to see that public health itself as a cross-cutting issue is going to be central to our investments in universal health coverage, to also shifting away the health system from the verticalization we've seen into HIV, into maternal health, into child health, into hypertension and diabetes, to be more of a cross-cutting issue, as we have seen and we have been taught by force, by COVID, that it is a cross-cutting issue, not a vertical issue. Health is cross-cutting. So these things, we expect them to stay in our behavior and also in our investment approaches.
Thank you so much, Dr. Gitai and Irungu, for your time and great insights as well. Wish we had more time to delve into this, but all the same, thank you. Let's take a short break here on Citizen Weekend. Much more ahead, including